All right, we're back. So last time we looked at the front and the back of the hip. The iliopsoas is our primary hip flexor, and the gluteus maximus is our primary hip extensor. Now we're going to look at the abductors, which are going to be on the sides of the pelvis, which, as the word sounds, are going to be the muscles that take us into abduction. So you can imagine them being situated on the side of the pelvis is going to put them to an advantage to shorten and lift the leg out to the side. So the first one we're going to look at is the gluteus medius. And we could think of the gluteus minimus along with it, and I'll just keep saying gluteus medius, but gluteus minimus is going to be a smaller version of it that has the same function, kind of like the Batman and Robin scenario that we looked at with infraspinatus and teres minor. But for our purposes, I'm going to speak of it as gluteus medius. So gluteus medius here is going to attach around the top of the iliac crest here and come down to this upper portion of the greater trochanter. Now, one thing that's really important to point out right away, one of the things I hear people a lot of times talk about are the glutes, right? And this term, the glutes, actually doesn't really tell us a lot now that we start to look at how different the gluteus maximus and the gluteus medius are. They have very different functions. Gluteus medius is really primarily an abductor, and we'll look at it in hip stability and other things. And we looked at gluteus maximus as having a very separate function in hip extension and potentially even external rotation. So one thing to pay attention to when you start talking about the glutes and the tissues is to make sure when you're talking about the glutes, you're differentiating between medius, which is very distinct from maximus. So medius, the muscle fiber orientation, and you can see this in your manual as well, is going to be coming from this iliac crest, really primarily on the side of the hip. So I like to think of this as a lateral muscle here. So whereas we had gluteus maximus as being this kind of this bulk of tissue here, gluteus medius is going to sit higher and more lateral, and the muscle fiber orientation is really going to be going more up and down rather than horizontally here, more vertically versus more horizontally. Clearly there's a little bit of an angle to it, which you can see in the picture, but really I'm thinking of this as a much higher, and remember when we palpated the iliac crest, we found that the iliac crest was about L2. So this is just below the iliac crest, so it sits pretty high, which most people don't think about their glutes here. You don't think about, oh, my glutes. Most people don't grab here, they grab here. So gluteus medius is this kind of lateral, much higher part of the hip. And we'll see why it has a very important function in the body as well. But the first thing we want to just consider, origin around the iliac crest, insertion on the greater trochanter here, and its main action that we're going to talk about is hip abduction. However, probably its even greater function is really that of stabilizing the hip. So think about your hip here. As I stand, the tendency here is for me to sag into my hip, and many of us might even sag in one direction. Some of us tend to sag forward, but our tendency is to kind of lay in the hips, and we see this in something like crescent lunge as well, where we might even lay in the hips here. We might lay in the hips in something like tree pose. And this gluteus medius is going to be what draws the hip into the socket. So it creates this cohesion and stability. One of really, if we had to pick out one primary stabilizer of the hip, it would be this gluteus medius, drawing the hip into the socket. Now we know that it's never that simple of a picture because it's a three-dimensional joint structure. So the stability comes, remember, from that trampoline effect, that balance of the tissues around it. But the gluteus medius is going to be that primary muscle that draws the hip into the socket to integrate that hip joint there. So when we look at this one, really this one's going to be active anytime I'm standing on one leg because it's going to be the primary muscle that helps to stabilize the hip. So you might even just take a moment to kind of feel this as I do it. You can feel that as I start to come onto one leg, my tendency, if I'm kind of sloppy about it, is to kind of lay in the hip. But the gluteus medius on the side of the hip is going to be able to draw the hip in and keep the pelvis level. So not only is it an abductor in its movement kind of function, but its stability function is to stabilize the pelvis. So the two sides of the gluteus medius work together to stabilize the pelvis in something like walking, so that I'm not walking like this. These gluteus medius muscles allow the pelvis to stay level anytime I'm standing on one leg, which happens every time I go through my gait cycle. There's that moment of one-legged stance as I walk or run. So it helps to stabilize the pelvis, and indirectly, it also helps to stabilize the SI joints, the lower back, as a result of the pelvis really being the foundation of stability for these features above it. So a pretty important muscle, a pretty important one to pay attention to, knowing again that we spend a lot of time on our feet. We spend a lot of time standing, and so a really important one to bring that integration into the hip. Really important for lower back, SI, and hip, and even pelvic stability, so that it is kind of that foundation of everything above it. So when we look at this one in yoga poses, one of the big things we look at, we've already mentioned, is anything that's standing on one leg. So any of our standing balances, tree pose is the obvious one that comes to mind, but even things like dancer, even somewhat half moon pose and Digasana. Think about it, and this is kind of a strange angle, but think about coming into Digasana here, and if you've been in a class, most of us have probably been in a class at some point where we were tired. Maybe we've already done a one-legged standing pose before we came into Digasana, and we find ourselves staying in it and getting tired. Our tendency is to start to lay into the hip. So the gluteus medius is what's going to contract to keep the pelvis level and steady and stable. And when we lose that, remember what tends to happen, we've got these active stabilizers of the muscles on top of the passive stabilizers of the joint. So as I start to come into Digasana, I lose that support of gluteus medius and I sag into the hip. Now I'm starting to lay into those passive hip structures, the cartilage, the labrum, the capsule, the ligaments, which can have all sorts of different implications, which might be negative or might be cumulative, or we may not notice anything at all for a while. But the gluteus medius, it's an important one too as you come into one-legged standing poses, just like many parts of our practice, that we have the opportunity to create support and integrity, or also to potentially lay into some of these deeper tissues of the joint themselves, and maybe even potentially irritate them. So gluteus medius, anytime I'm standing on one leg. Another one that's helpful to strengthen gluteus medius is Vashisthasana, or side plank. So as I come into Vashisthasana, the gluteus medius is going to contract as I push my feet into the floor and lift my hips. Now clearly there's other muscles working with it, but as I push my feet into the floor, you can imagine this sense of abduction happening as I go from this shape to this shape, right? And I'm pushing my foot into the floor to relatively abduct. And this is where you kind of have to visualize as you come into the poses what's happening in a different scenario. So if Vashisthasana is abducting here, if I can imagine that happening upright here, right? There's this abduction as I push my foot into the floor to lift my hips, which is coming from that gluteus medius. So I kind of have to be able to kind of flip the poses around in my head sometimes to visualize what's happening. So we also have it in half moon, especially on the lifted leg. So think about what's happening in Ardha Chandrasana with my lifted leg here, abducting. So I'm trying to keep the toes pointing forward and the foot parallel to the ground, but now I have gravity pushing down on me here. So my leg is abducting isometrically against the resistance of gravity pushing down. So though it might not be the first thing to get tired, there might be many other things getting tired first, my abductors are working to lift up that back leg parallel to the floor. Now to stretch this one. So abduction, remember, is the primary function, even though like all the other muscles, there are some other accessory functions that this muscle has. The primary function is going to be abduction and stability for the hip and pelvis. So to stretch it, knowing that the tissues are here, contracting to abduct, I want to be able to adduct or draw the leg across the body to some extent to be able to feel a stretch. Now again, we know that the primary function of this muscle is really to stabilize the hip. So I'm not necessarily needing a huge stretch. As you can imagine, that probably wouldn't happen because it'd be very difficult to take my leg across my body in this orientation. But I'm looking for a gentle lengthening of the tissues here. So one of the kind of clear poses that we can use to help stretch this one, that's really obvious is Gomukhasana, which is why for many people this pose becomes really challenging, because now not only am I externally rotating and targeting some of the other hip muscles, I'll also, as I fold forward, flex the hips and target gluteus maximus, which we looked at already. But now I'm also adducting and targeting these really tight, what tend to be tighter outer hip muscles as well. And gluteus medius, kind of like the psoas, tends to be one of those muscles that tends to get tight and weak. So when we look at gluteus medius, one of the clear ways to stretch is Gomukhasana. For many people, though, this pose might not be accessible because we have a lot going on, and it's a pretty big stretch for many people. So now kind of back to this orientation, this context of being able to kind of spin the body in different directions. If you can imagine in Ardha Matsyendrasana, as I turn the torso around, one of the things I'm also doing as a byproduct is relatively adducting my leg across the midline. So remember, adduction is anytime I draw the leg across the midline or toward the midline. So from here, my midline starts here, right? As I rotate, I'm stretching those adductors as I move the midline instead of the leg to stretch and relatively adduct the leg. So generally speaking, a lot of people will find Ardha Matsyendrasana a little bit more accessible. Again, clearly there's other things happening here in the glute maximus and the rotators, so they may feel it more in one area, and others might feel it more in the outer hip and thigh. So gluteus medius, we can look at there. We can, if they're still really tight and they're having problems coming into it, we can always modify, and some people might even feel it in something like Sukhasana, where they bring the legs together. Clearly, if someone's really tight in these outer hip muscles, it's not going to take a lot for them to feel a stretch. But the main ones we'll look at are Gomukhasana and Ardha Matsyendrasana, as those will really be adducting the legs more. So when we look at gluteus medius, it's really a key feature of the integrity of the hip joint, especially when we're looking at things like the cartilage and the labrum and the ability to create stability and cohesion in this joint that we know is already pretty stable, but still needs some support since we spend a lot of time on our legs. And think about how many people and how many times in your life you tend to kind of sag into the joint, whether that's during your day standing in the grocery line, or whether that's in your yoga practice as you get tired. And that opportunity to create some stability here, which is really, really helpful for the health of the hip joint over time. So gluteus medius, an important one to remember in your practice. It doesn't need to be fancy, but what I'm thinking about, again, as far as cueing, is simply drawing the hip into the socket, whether that's tree pose, right, drawing the hip into the socket, or Digasana, drawing the hip into the socket. That hugging in is going to be what activates the gluteus medius. So in many ways, some of the subtler things that we do in the cueing and the awareness of the joint itself will be more helpful than big movements into abduction, since its primary role is a stabilizer. So one of my favorites, a really important one, especially important in my experience anytime someone has SI joint issues, low back issues, hip issues. It's really hard to generalize like that, but I'd say it's one of the ones that you could come back to over and over again. So next, let's also look at the Tensor Fasciae Latae. So TFL, the shorthand for Tensor Fasciae Latae, is the TFL. The TFL is going to go from kind of just below the ASIS. So we talked about that frontal hip bone. It's going to go from just below the ASIS, and it's going to attach onto the IT band. So if you remember back to the other one we mentioned that attaches to the IT band, we had one other muscle that attaches to the IT band. Remember from the back, we had gluteus maximus attaching on the IT band. So now slightly more from the front, we've got the TFL. And in fact, the TFL is an interesting one because it is somewhat on the front, somewhat on the side. So this one is commonly referred to as the pocket muscle because it's often where your pants pockets lie. Clearly, it depends on what kind of pants you wear, but it's in this kind of general orientation where your pant pocket would be. In fact, mine are pretty close. So when we look at this, we've got the ASIS just slightly below it, attaching to the iliotibial band on the side of the thigh here. So it's going through this orientation like the pocket of your pants might go. Now, just to take a moment to talk about the IT band. The IT band is this fibrous connective tissue that runs from the pelvis all the way down to just below the knee. And it's a really important thickening of this band of the tissue on the side of the leg that helps to create cohesion and stability between the hip and the knee. And it's really important that we have that sense of integrity. There tends to be this idea floating around that we maybe need to stretch our RT band. And clearly any of the tissues can get tighter and have more tension on them, but the IT band is actually simply connective tissue. What happens, the problem that happens that we run into is when the tissues that attach to it become tight and pull on the IT band like puppet strings and create a sense of tension on this connective tissue. Remember, connective tissue, just like the ligaments and the tendons, has very little elastin. So this IT band has very little capacity to stretch. So you can think of this as like fibrous tissue. In fact, if you've ever looked at a steak or a piece of meat, you see that kind of gristle in it, that white tissue, or if you've looked at a cadaver, you see all the white connective tissue, which is kind of tough and gristly. And it's very similar. All of the connective tissue is somewhat similar in that sense, that it's this kind of tight, fibrous tissue that creates a connector, an important stability. You could imagine if you were walking around and you didn't have an IT band, there'd be a lot more movement happening. It's hard to even pretend to show, right? There'd be a lot more movement happening laterally in the hip and the knee, which we don't want to have happen. So it's a really important stabilizer and connector, coordinator of the hip and the knee joint. So the problem we run into happens when the tissues that either connect to it or underlie it get tight and pull on it and create this sense of tension on it. So one of those is the IT band. Another could be gluteus maximus. Later we'll look at the quadriceps that come underneath the IT band, which can also adhere to the IT band and create some tension on the IT band as well. But it's helpful just to kind of understand some of the basics of that, because if someone's having issues with their IT band, sometimes manifesting as knee pain, lateral knee pain, because the IT band comes right underneath the outer knee here. Sometimes manifesting as outer thigh pain, is that if there are issues there in the IT band, oftentimes I have to look at the hip. Right? So that might be really, it could be really any part of the hip, because this connective tissue is all connected to some extent. But clearly we have this issue of the TFL connecting directly and the gluteus maximus connecting directly. So the TFL, somewhat on the front of the hip, somewhat more on the lateral hip, has some interesting actions of its own. It's not really very strong at any one of them. So you wouldn't necessarily think of the TFL as a really strong muscle in any scenario, but really more as an assistant in several different movements. So if we have the TFL running from here to here, right, and I draw these 2 points toward each other, one option could be hip flexion. Another option could be some abduction. And yet another option could be some internal, he doesn't do it very well, but some internal rotation. So if you take your legs out in front of you, whether you're sitting in a chair or on the floor, and you find this kind of pocket scenario here, and you take yourself into Paschimottanasana, you can feel it contract as you lean forward and internally rotate. You can start to feel where that pocket is. And I think that's helpful because there's not one clear action associated with this one. So we've got hip flexion, abduction, and internal rotation, none of it that it's very powerful at. In fact, the other hip flexors are going to do a lot more than the TFL alone can. The other abductor are going to do a lot more than TFL alone can. However, it is one of our primary internal rotators, and we'll see later that we've got a lot of really strong external rotators. We actually have very few internal rotators. This is the only one we're going to talk about, and it's actually not very strong at it either. So that's helpful to understand the tendency of the body too is to be inclined toward this external rotation scenario in the hips. Part of that will also depend on the bony structure of the individual as well. So TFL, we've got hip flexion, abduction, internal rotation. We also have it pulling on the IT band to create some stability and coordination for the hip and the knee. And sometimes that pulling is a good thing. Again, think of it like a puppet string. It helps us to coordinate movements through the IT band. When that becomes chronically tight, clearly it can create some pressure and tension through that system and through the knee. So it's going to work with the gluteus medius as an abductor and also the IT band as a stabilizer of the hip and also indirectly the knee through the IT band. So poses that will activate this muscle. Again, it's not a primary mover for any of those movements. So there's not necessarily one pose, but it could be several. Paschimottanasana is probably the closest that we could find because in Paschimottanasana, I'm flexing the hip, I'm adducting to keep the legs together, and I'm also somewhat internally rotating to make sure my toes are pointing up. So as I fold forward, internally rotate, and keep the legs together, I feel that function of TFL, and that's probably the clearest picture you'll find of the TFL being at its finest for contraction. Also, a similar engagement here would be Utthita Hasta Padangusthasana again. So again, I have the leg adducted toward the midline, flexed, and internally rotated so the toes point up there. Now stretching this one can be a tricky thing. Think about this as well, and this kind of goes for the abductors as well. What we want to think about for gluteus medius, the other abductor we talked about, what we want to think about when we're stretching these abductors is that I don't need a huge range of motion. Remember, I do want some support in these tissues so there's not a lot of laxity around the hip joint itself. But what I want is pliability. So I'm not necessarily looking for huge range of motion as much as gentle stretching of these stabilizing tissues of the outer hip. So what we're looking for is really anything with some kind of side bending scenario to it. Clearly the ones we looked at for gluteus medius might also be stretching this one a little bit. But remember, this one's a little bit more on the front of the hip compared to gluteus medius, which is a little bit more on the back of the hip. And together they create this kind of the side of the hip together. But for TFL in particular, one thing that can be especially helpful is side bending and a lunge. Trying to take it out of the back bend and more into the side stretch. So I'm using my abdominals to help support the belly as I lean away and gently feel a stretch, potentially all down the thigh and the hip, though I might still feel some in the hip flexor. Any of these side bending poses, again, I'm going to feel something down the whole chain, but if I'm feeling tension here, I'm going to be feeling it probably a little bit more in the outer hip. I could do the same thing lying on my back, side bending in a kind of a, what I call supine moon, or standing moon, or side stretch and standing lunges. And again, it's not an area that I need or even want to be super flexible in, because as I walk around and I move around in my day-to-day life, I want this integrity and stability. So the range of motion I want here is actually just more of the pliability, the elasticity of the tissues so they're not getting really hardened and tight and losing oxygen like we talked about in the very beginning, this importance of the pliability of the muscles to stay oxygenated and get good circulation. But that I don't need a lot of this contraction and relaxation because the contraction is going to be very small because it's mostly a stabilizing muscle. So I'm not looking for huge range of motion, but I am looking to create some elasticity and pliability within the tissues that are working so hard throughout the day to help support the hip joint. Both the TFL as well as the gluteus medius. The TFL especially tends to be really tight, in particular, even more probably than the gluteus medius, but again, it depends on the person. So again, I'm not looking for a huge range of motion, but I am looking to try and release. And when I use that word, I think of releasing as letting go of tension in the tissues versus a big stretch. So I am looking to release any tension in those tissues so that they can really be good at performing their function of stabilizing. So our abductors on the side of the hip, gluteus medius and minimus, we said. TFL on a little bit more to the front are going to really be important for the stability of the hip, but also the stability of the knee via the IT band. In conjunction with the gluteus maximus on the back, the iliopsoas on the front, we're starting to create that three-dimensional trampoline effect to support and find integrity in the hip joint. Next time, we'll look at the adductors and the rotators. I'll see you soon.